So when you ask what is it for, the answer is for chronic pain. And chronic pain can be due to ongoing painful input. Say slapping the face continuously.
That's going to do it.
You can do that for 3 months and you have 3 months pain, right? But most people are puzzled because chronic pain have no physical signs. And that type of pain, you say, it's non-injury chronic pain. And that's the pain I started to research in since 1969.
Wow.
It's a long time. And one thing has been consistent. We found out that this type of pain is not pain in the sense that, ouch, it's caused by altered sensitivity in the nervous system. Instead of being something hurting you, instead of something injuring you, is the body being overly sensitive. It's like photophobia.
Yeah.
It's not the light that's hurting you, but your eyes is overly sensitive.
It's interesting you say that, because if you say it from 1969 to now, the research in the last even 5 years or so has changed so much with pain, and it would absolutely reinforce that.
Yes.
That opinion.
So the word they now use is the word I introduced for this type of pain. And because this type of pain is caused by overly sensitive nerve, the nerves are neuropathic. So I've called this neuropathic pain. For treating this type of pain, the first thing you must remember and understand is it's not nociception, it's not noxious input, it's not something hurting you, it's your body being overly sensitive. Overly sensitive to normal input, standing, sitting, or just ordinary people having pain.
And you said that with respect to that chronic pain, there's no physical signs, but in the assessment process you go through, there are definite physical signs that you picked up on that you're.
Yes, and they've all been described, and they're all related to the peripheral nerve. So everything is overly sensitive in peripheral receptors. So the peripheral receptors will make the blood vessels go constricted, and therefore you get cold, and eventually you might even lead to that part dying, gangrenous. But the earliest part is the sensitivity to temperature, sensitivity to pressure, to any form of input. And this follows a very important law of physiology, which is not well known. This is known as Cannon's law. Professor Cannon, who's dead now, he was professor of physiology at Harvard in the 30s. And he was the first to describe how if your nerve was not well, it becomes 1,000 times too sensitive. And this is the basis of the type of pain we're talking about. Chronic pain due to oversensitivity. And that's known as Cannon's law of supersensitivity. And you must understand that, and we go through the physiology of that. But once you understand neuropathic pain and our principle, you will forget all about other forms of diagnosis and treatment. And this is very important because so many people suffer from chronic pain. And it's not understood by most people who treat it.